Good day to all of you. I am Dr. REKHA Balakrishnan, Eye Specialist, Deputy Director, Balakrishna Eye Hospital, Saidapet, Chennai. Today, we all have assembled here for a glaucoma seminar and a free eye camp. My hearty welcome to all of you present here. I shall be giving a brief talk about a condition called glaucoma, about its clinical signs and symptoms, treatment and prevention. Glaucoma is a condition where the patient ultimately can become blind due to damage of the optic nerve, if not treated in time. Blindness is the worst form of handicap that can come to an individual. We cannot even imagine losing vision due to any cause. About 5% of the population are becoming blind due to glaucoma. One of the main causes for glaucoma is raised intraocular pressure or increased pressure inside the eye. Normal eye pressure range is between 10 to 22 millimeter mercury. Inside the eye there is a fluid called aqueous humor which is produced by ciliary processes, which is positioned between the brown or black colored iris and the lens. This fluid has a drainage system. The fluid produced will pass through the angle which is situated between the iris and the transparent cornea. Any defect leading to the block of this angle or increased fluid production which is not drained properly can lead to raised intraocular pressure. Many types of glaucoma are there, but the most common is the open angle glaucoma, which is mainly causing blindness. 7% of open angle glaucoma are hereditary. Open angle glaucoma generally manifests after the age of 35, and more percentage of people are affected as age advances. Glaucoma is generally seen more in patients with myopia, diabetes, hypertension, continuous use of steroid eye drops, thyroid disorder and smokers. Now, what are the symptoms of glaucoma? Initially, patient does not realize any symptoms. Some of the vague symptoms are frequent change of spectacles, difficulty in reading, occasional attacks of headache, delayed visual dark adaptation, difficulty in driving. In more advanced cases, visual field, that is sight vision, will gradually decrease, and if not treated in time, the visual field shall reduce to such an extent that the patient will have only tubular vision, and still not treated can lead to total blindness. So, this is a disease which stealthily steals our vision. Now, let us see various tests which can diagnose glaucoma. Visual field defects, damage to the optic nerve, that is the nerve from the eye to the brain, increased eye pressure, blocked angles of the eye are assessed by various tests. Tonometry, measuring pressure of the eye, perimetry to view the visual fields, gonioscopy to observe the angles of the eye, ophthalmoscopy and optical coherence tomography to detect the extent of nerve damage. Now, let us see various treatment options. Just like any other nerve in the body, even the optic nerve damage is irreversible. Sometimes symptoms like field defect will start only after 40% of the optic nerve has been damaged due to the increased pressure inside the eye. Therefore, early detection and early treatment to reduce the eye pressure is very important. Some of the drops that are used to reduce eye pressure are prostaglandin groups like latanoprost, travoprost, bimetoprost, and beta blockers like timolol maleate and betaxolol, adrenergic drugs like carbonic anhydrase inhibitors like dorzolamide and brinzolamide, cholinergic groups like pilocarpine, tablets like acetazolamide, then 20% mannitol in the form of intravenous infusion, oral glycerol are some of the other medications used in glaucoma. Now, other treatments include argon laser trabeculoplasty and surgical procedures like trabeculectomy and drainage surgeries using Ahmed valve implant and Molteno valve implant. Cyclocryotherapy and cyclophotocoagulation are for end stage glaucoma. We know that prevention is better than cure. Our Upanishads say that Shariram Madhyam Khalu Dharma Sadhanam, which means maintain our body as an instrument to face any eventuality. From the age of 35 years, periodical eye checkup must be done once in 6 months, especially those who have family history of glaucoma. Lost vision cannot be regained. Avoid steroid eye drops for prolonged periods and should be applied only under medical supervision. Obesity should be reduced. Brisk walking for 40 minutes daily, yoga and meditation may be practiced. Mental health is equally important like body health. Abstain from smoking, alcohol intake and narcotics. Nobody should suffer from blindness in this world. Blindness should be eradicated from this world. Let us join together to create awareness about blindness and glaucoma. Thanks for the patient hearing. Jai Hind.